Hello, my name is Peter Graaff. I'm the Director Special Initiatives at the Health Emergencies program here in Geneva. As we have already learned in Module 2, WHO has released a practical guide for UN country teams, the Operational Planning Guidelines to support country preparedness and response. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country plans. And this plan will be operational between now and April the 30th. The country guidelines are structured along 8 key pillars of the public health response. Pillars are operationalized by actions to be taken to enhance country preparedness. The focus today is Pillar 1, country-level coordination, planning and monitoring. With this video, we will describe the actions to be taken within this pillar. This is relevant at country and sub-country level for governments, UN country teams as well as partners. The goal is that, after watching this video, you will be able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we presented high-level actions and recommendations of Pillar 1, emphasizing the importance of activating national public health emergency management mechanisms. This includes planning, operations, logistics and finance in full cooperation with partners. National action plans for health security and pandemic influenza preparedness also need to be activated. Let's now take a deeper look at the practices. There will be 3 levels of preparedness in coordination, planning and monitoring, starting from basic, level 1, to sustainable, level 3. At level 1, countries should ensure that the national level coordination mechanism is established between key ministries and partners across all sectors, and that this coordination mechanism is convened in a timely manner. This is a key political forum to ensure that all stakeholders have a common understanding and vision of the preparedness and response to COVID-19. By nature, as an emerging virus originating from zoonotic reservoir, and given its scale, with a public health emergency of international concern declared on January the 30th, this event is multi-sectoral and requires coordination mechanisms at all levels to ensure the success of the global response led by the UN system. The global strategy should be translated into a country-specific preparedness and response plan with estimated resource requirements, or preferably adapted, where available, from an existing influenza pandemic preparedness plan. The country SPRP is based on a risk analysis and developed with national authorities and key partners. In addition, attention should be brought to conducting initial capacity assessment and risk analysis, including mapping of vulnerable populations. Already at this stage, the basic mechanisms and metrics to evaluate the effectiveness and impact of planned measurements should be initiated. Monitoring is an integral part of program implementation and should be linked to the specific objectives defined in the country plan. At level 2, an incident management team, or IMT, is required to establish preparedness. This implies the rapid deployment of designated staff from national and partner organizations within a public health emergency operations center, or equivalent if available. The Public Health Emergency Operations Center is part of a public health emergency management program of risk analysis, preparedness, response and recovery. Its 5 essential functions are 1. Management, 2. Operations, 3. Planning, 4. Logistics and 5. Finance and administration. Additionally, spokespeople need to be designated and trained within the IMT structure. The IMT will ensure that the operational plan is implemented, including engaging with international or local donors and existing programs to mobilize and allocate resources. The IMT will further detail roles and responsibilities for the Ministry of Health and other response agencies, sectors and jurisdictions at the various levels in the response organization, including private sector and NGO organizations. The preparedness and response actions for COVID-19 should be developed and implemented in accordance with the scope of federal, state, tribal and local statutory and of regulatory authority, as well as through state and/or federal declarations of emergency. Review of regulatory requirements and legal basis is therefore fundamental. Under the IHR, or International Health Regulations, governments are entitled to implement public health measures to protect the health of the populations during public health events, respecting 3 golden rules. Measures must 1. Be based on scientific principles and evidence, 2. Respect human rights and fundamental freedoms of travelers, and 3. Not be more invasive or intrusive than reasonably available alternatives. When such measures significantly interfere with international traffic, such as by preventing, delaying or refusing entry to international travelers or goods for more than 24 hours, countries are obliged to provide the public health rationale to WHO within 48 hours of implementation. The IMT is also responsible to monitor the effectiveness of the operational plan and measures, as well as to assess their social acceptance. A list of key performance indicators is provided in the Strategic Response Plan as a basis for monitoring key aspects of the implementation. At level 3, when coordination, planning and monitoring is sustained, countries should conduct further review of operational success and gaps based on the monitoring system, the KPI metrics, and ensure that issues are brought to the attention of the relevant authorities in a timely manner and to adjust plans and resources as needed. All exercises and live activations should be followed by an after-action review, providing actionable recommendations, identifying areas for improvement, and when necessary, implementing corrective actions. It is important that lessons are documented to inform future activities. Now that you have watched this video, you should be able to describe each action in country-level coordination, planning and monitoring, and be ready to assess whether each has already been or needs to be implemented at country or sub-country level. It is important to keep in mind that the actions presented in this video are a guide and should not, and I repeat not, supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national plans and accelerate national preparedness. For more information, you may access the operational planning guidelines in the additional resources section of the training platform. You are now ready to begin the assessment using the WHO online planning tool for COVID-19. Thank you for watching this video.